So my name's Dr. Gabby and I work here at Windsor Dental. And my special interest is in restorative and aesthetic dentistry. I do most of the composite bonding cases here, clear aligners and porcelain veneer treatments as well. I typically get patients that are unhappy with the smiles and they want to improve them, make them whiter, brighter, more aligned, or just give them more shape as well and get back to what they naturally had, especially patients that had an aging dentition and the teeth might have got shorter or they might have become stained over a period of time. I mainly focus on doing orthodontic treatment and composite bonding. Those are my two specialities, and I've become a master of both over a period of time, doing extensive training for my postgraduate degree and also intense mentorship as well to make sure I provide the highest standard of care for my patients. The best place to start if you're unhappy with your smile is to come in for a consultation where we can do an in-depth consultation looking at the health of your teeth, looking at the history of what's going on with your dental treatment as well, taking some photographs and a 3D scan so then we can look to design your dream smile. My patients normally ask, am I going to look like my teeth are fake? Are they going to look unnatural? And that is the biggest concern most of my patients have. And the way that I, settle a lot of my patients' ease is that I work by digitally designing my smiles. So I take portrait photos of my patients and then I can use that to make sure I pick the perfect shapes and sizes of the teeth to make sure it fits that patient's face perfectly. And that means I can also discuss it with my patients and make sure they're happy as well before they commit to treatment. So initially our patients will inquire and they'll be greeted by a treatment coordinator who will ask them a few questions about what their concerns are about their smiles. And then they'll be booked in with me for an in-depth consultation whereby we'll do the in-depth examination of the health and the aesthetics of the teeth, take some photographs as well, and also do a 3D scan to then be able to design my patient's dream smile. I also digitally design my smiles so then I can show my patients a design before we do any treatment. I can also show them what their smile will look like in a temporary material before they commit. Finance is a fantastic tool for our patients to be able to access their treatment. It means that you can pay for your treatment over a period of time, even with that being 6 months, 1 year or over 2 to 3 years as well, on 0% interest in cases over £3,000. It's super important that you do your research into your dentist that you're going to have treatment with. You want to ensure that you're going to provide the highest quality of care, ensuring that you're seeing for reviews regularly for your orthodontic treatment to ensure that the teeth are remaining healthy, that they're moving in the correct way, and your treatment is nice and stable.